All Tripura Government Doctors Association has demanded for establishment of a state-level dedicated COVID hospital in Tripura, as major hospitals of the state are dealing with both COVID and non-COVID patients, which creates huge risk to all. The ATGDA also demanded a one-time incentive for all categories of health staff. Meanwhile, state's corona graph continues to swell as 106 more COVID-19 positive cases were detected, taking the stats daily to 3,777 with 1,617 out of which active cases and 11 persons have died so far. The All Tripura Government Doctors Association has come up with a set of suggestions and demands for the state government to contain the spread of the COVID-19 pandemic. All Tripura Government Doctors Association demanded for establishment of a state-level dedicated COVID hospital in Tripura, as major hospitals of the state are dealing with both COVID and non-COVID patients, which is creating huge risk of all the patients, common public and as well as health community workers. Addressing a press conference at the Agartala Press Club, Dr. Rajesh Chaudhary, General Secretary of the ATGDA, raised this demand on Friday in presence of other executive members of the organization.
In all the major hospitals in our state, both corona positive and general patients, both are being treated. So through this process, there is a chance of infection of the general people by the increased viral load of these hospitals, and also the medical staff who are engaged in the treatment of COVID, they are going for isolation and quarantine. So it's very much problematic to maintain all the patients. It will be very much helpful if we establish a dedicated COVID hospital in our state.
Dr. Chaudhary also viewed that there is a huge crisis of medical officers, staff nurses and other health staff, and also the state government should immediately recruit them, especially to combat the pandemic smoothly.
We are having very less number of doctors in our state. Above this, due to this corona pandemic, we have to take care of the flu clinic, we have to take care of the COVID care center, we have to take care of the COVID ICU, and many doctors are going for quarantine and isolation. So there are severe lack of doctors. So we demand immediate treatment of at least 150 number of doctors and sufficient number of nurses and all necessary staffs. It is very much urgent to combat this corona pandemic.
He also demanded that the state government should declare one-time incentive for all the health community workers. Later, State Education and Law Minister Ratan Lal Nath, also the spokesperson of the government, when asked in the Secretariat on the government's view on the demand raised by the ATGDA, he said that the member of the ATGDA has met him and the government is aware of their demand, and very soon some of the demands may be fulfilled. Meanwhile, Tripura on Friday registered 106 fresh COVID-19 positive cases, taking the state's tally to 3,777. Of the total 4,045 samples tested, 106 people tested positive for the virus. With this, active cases now stands at 1,617. Out of this, 11 persons have died so far. Altogether, 2,131 persons have recovered from the disease so far in the state. Taking to Twitter, Chief Minister Biplab Kumar Deb confirmed the new infection of COVID-19 and urged the people of the state to remain alert. Bureau Report.